I think we're ready to start the next session. It will be Zhicheng who's going to kick us off with some legal aspects of AAL technologies. So Zhicheng, the floor is yours.
Thank you, Leanne. Good afternoon, everyone. Welcome to my presentation. Can you hear me well? Great. So welcome to my presentation. And first of all, I wanted to say a big thanks to all of the previous presenters earlier today for their great presentations. I really enjoyed it a lot. So they have approached the visual project, the field of AAL and digital health, from a technical perspective. They have really shown us how great technologies can be when they are being introduced into the field of healthcare. And now I wanted to bridge technology and privacy and look into the legal approaches to health data governance in the European Union and in China. Now, as I said, the technical advances in the field of healthcare is always the biggest source of my research inspiration because it has really shown us the potential that we can achieve when we utilize health data for many great purposes, such as scientific research, model training, product development, and so on. So there is this huge need to utilize health data for good purposes. But on the other hand, there is also this need to protect health data privacy because the context that we're talking about here, such as in hospitals and in other private settings, like in community homes and private homes, they are very private scenarios, and sometimes the end users are very vulnerable. So there is also this huge need to protect health data privacy. And this leads me to a hypothesis that is, if a society wishes to reap the benefits of digital healthcare, it must respond to these two needs at the legal level. That is, to enhance health data protection on one hand, but also to facilitate the use of health data for good purposes on the other hand. But how to do that from a legal perspective? And that is the question that I wanted to explore in my PhD project by looking into the legal regulations of the European Union and China. More specifically, my research question is, in an era where emerging IT technologies are deeply integrated into healthcare and caregiving, what legal frameworks have the EU and China adopted to enhance the protection of health data and also facilitate its use? What are the similarities and differences between their approaches, and how can their legal frameworks be improved? So this is the main research question. Accordingly, I have three main research objectives. The first objective is to figure out the legal approaches of health data governance in the European Union and in China. So this in legal research is more, we call it more descriptive legal research in the sense that it wants to systemize the positivist law as they are. And the second objective is to investigate areas for a law improvement, which places can be better and how do I make recommendations. So this in legal research is more normative in the sense that it queries about what should the law be like. And the third objective is to conduct a comparative study between the legal models of health data governance here in the European Union and in China. So this objective is comparative in legal research in the sense that it questions the similarities and differences in different jurisdictions. So these are the three main objectives of my PhD project. How to do that? And this is my research design in a nutshell. So basically three main pillars or steps, as you could say. I began by digging into the technical phenomenon of digital health, and then I go on to investigate the legal rules surround health data protection and usage in the EU and in China. And then I go on to discuss the technical legal solutions that are proposed to mitigate the usage and protection of health data, that is, privacy-enhancing technologies, with a focus on anonymization. So as I said, the first step was to investigate this societal and technical phenomenon of digital health transformation. So as we have already seen earlier today, so there are so many different kinds of digital technologies that have already been researched and introduced into the field of healthcare, such as wearables, sensors, robotics, you name it, there's so many. But what does digital health mean? What's its definition and what does it entail? So that is a question that I wanted to explore in this part. So here I reviewed many relevant literatures in this area and provided a taxonomy of digital health by their intended users instead of by the group of technologies. So mainly 4 different groups. The first group is professional healthcare providers. Many technologies have been proposed for them to solve their needs. And the second group is patients, caregivers, and the public. So they're non-professionals, but sometimes sit at the end user side of the technologies. And the third group is health researchers who does research in this field of healthcare. And the fourth group is health system managers. They manage our healthcare systems. So 4 different groups, many technologies also. The purpose of this practice is not to exhaust all the technologies that has ever been introduced into the field of healthcare, because there will be too many and that is outside of the scope of this dissertation. The purpose is to help us better understand this societal and this technical phenomenon of digital health. What are the important stakeholders and end users in this scenario, and also under what kind of different contexts are health data being used? So this is also very important for the legal study that follows. So this technological phenomenon of digital health shows that there is this huge need to use health data. But also this study also finds that there are some health data privacy concerns, such as the Googleization of health and care, which means that many private big techs are entering into the field of health research. This has never been seen before, like Google. The intrusion of new technologies like IoT and big data, so which means that the scale of data processing nowadays, not to mention those big models, is also at a scale that has not been seen before. And some legal scholars even argue that there is this death of privacy in the context of healthcare extension, by which they mean that if there are sensors everywhere, then it is very unlikely to achieve good privacy, which I don't completely agree, but there are several concerns that has been raised in literature. So on the basis of this study, I then go on to the legal research. That is to investigate what kind of legal rules and approaches have been introduced by the European Union and by China to regulate the protection and the usage of health data. So, and in this part, the research method that I use is called comparative legal research, basically comparing the similarities and differences of different legal systems. But more specifically, I follow the theories and methods proposed by Professor He Shou. He is a Canadian constitutional law scholar who wrote a beautiful book about comparative law methodology. So he proposed several theories for conducting case selection, for example. So there are several principles such as most similar cases principle, prototypical cases principle, outlier cases principle, and so on. More specifically, here I follow the most different cases principle in the sense that in my study I've chosen to investigate the legal rules of the European Union at the EU level and the legal rules of China. So these 2 cases and jurisdictions are radically different in many scenarios such as history, culture, language, norms, and so on. But we could also notice that they are now facing a similar kind of societal challenge. That is, the population is getting older and older, and we will be lacking out of healthcare resources in the future. And both places wanting to use technology to solve the problem. And then under this scenario, how could the legal system respond? So that is the part I wanted to explore in my study. So this is the more concrete and specific framework that I used to do the comparative legal study. So basically, I look at the legal rules of the European Union and China through these 5 different perspectives or angles, as you could say, which include legislative path choices, protection mechanism, the legal basis for health data usage, the role of anonymization, and the trend of development. So this is the sort of prism that I use to investigate different jurisdictions. Today, I don't think I can cover all of them, but I think it will be interesting for us to have a look at some of the similarities and differences. This is the legislative path that I will not show today. Let's probably have a look at the utilization mechanism in law. So when can we actually use health data under the law? If you are familiar with the European Union's GDPR, you may know that under the GDPR there is this sensitive data mechanism under Article 9 of the law. So to put it simply, in principle, health data is a group of sensitive data, and it is in principle prohibited, forbidden to be used, unless there is a good purpose in law, such as substantial public interest, medical care, public health, and so on. So very strict framework here under the European Union's GDPR. But this is the status quo. And it is changing because the system has been identified to have some problems when it comes to the harmonization of rules in the European Union. So to mobilize the use of health data, the European Union is introducing a new law called the European Health Data Space Regulation. This is currently still a legislative proposal, but if this is passed, it will significantly update and supplement the rules of the GDPR that is the status quo right now. So this is the European Union's approach in general, in a nutshell. What about China then? So China just adopted its first ever data protection law in the end of 2021. And it also introduced this sensitive data system. And similarly, health data is a group of sensitive data, just like the European Union's GDPR. So if we look at the outset, it seems that the two jurisdictions share many similarities on this point. But if we look closely, we will find that health data and other sensitive data is not prohibited to be used, like in the GDPR. So here, there is not a general prohibition to use health data. So long as there is a specific purpose, a sufficient need, and there are protective measures, then health data can be used lawfully according to the Chinese framework. So that is a major difference and a paradigm difference, as I would say, when it comes to the usage of data under the Chinese framework. So this is just an example to show you some of the similar or different approaches of different jurisdictions. And there are more. So on that basis, I then go on to the third part of my research, that is the techno-legal phenomenon or technology that has been proposed to mitigate health data usage and protection. That is privacy-enhancing technology. And here I focus on anonymization. So we have listened to this wonderful research of Sid, Kushan, about how powerful these technologies could be. But oftentimes when we talk about anonymization in technology, it doesn't mean necessarily the same thing as we talk about it in law. And when we talk about it in law, sometimes we don't know what we're talking about because the legal construction and the legal interpretation of this term is extremely complex. So here I wanted to study the legal construction and the legal role of anonymization in the context of health data processing. Let's first have a look at the Chinese approach. So in their data protection law, so they have adopted the concept of anonymization, which is kind of similar to the GDPR. But that's it. That's all that is in the law. So no other guidance or other legal obligations in the law. But if we look even more closely into the Chinese legal system, we will find that the standard making activities in this area is very active. So they have actually introduced many standards, national standards on anonymization and de-identification, such as the standard for reviewing the effect of de-identification, which I'm not digging into details right now. But what about the European Union then? So there are also many standards on anonymization in the European Union that comes from the European Standard Agency and other international standard agencies such as ICO and so on. But the main difference is that the legal construction and the legal notion of anonymization seems to be stronger here in European Union law. And there are many legal discussions also in scholarship around the interpretation of what constitutes anonymization in law. So here my research is also built on existing literature. For example, Li Yan's article on anonymization in the context of health data sharing. So after reviewing many legal instruments and case law, I found that the legal interpretation of anonymization has shifted from a more stringent approach to a more contextual approach. Now, what is even more interesting is that in the forthcoming European health data space regulation, there are more stronger legal obligations that are imposed to anonymization. So if this law is to be passed, then it will be a legal obligation to anonymize health data before it can be used. So this is the European side of the story. And then my research went a step further because I wanted to sort of understand the relationships between several privacy-enhancing technologies and existing data protection principles. So I did this case study, or you could call it a thought experiment based on a research conducted by Sid, Paco, and Paul. So in their paper, they have proposed a taxonomy, which contains 5 different groups of privacy-enhancing technologies in the field of AAL. So I tried to figure out and try to match them with data protection principles, such as anonymization, pseudonymization, and data protection by design. The practice is very interesting. So basically, as Sid just said, that most of these technologies, they can be understood as data protection by design practice. But when it comes to anonymization, it is more interesting in the sense that regardless of what they are called in literature, sometimes anonymization, de-identification methods, I found that most of the groups that is presented here can actually be understood as pseudonymization methods in the sense that most of them have this technical reversibility. But this general understanding is also subject to change because, as I said, the legal construction of anonymization has also been through a stage of changing from a more stringent approach to a more contextual approach, which means that if we need to analyze the legal status and legal role of these technologies from a more closer and a more case-by-case perspective. But this study also shows us that it is very interesting. It is also very necessary to bring a closer law and technology so that we could have more interesting findings. So this basically brings me to the end of my presentation. So basically my research starts with the technological phenomenon of digital health, and then I went on to look at the legal rules for health data protection and utilization of the European Union and China, and I conducted a comparative study between them. And then I went on to discuss this techno-legal mitigation, that is, with a focus on anonymization. So here, thank you all for your patience and for listening. Thank you very much.
Are there any questions from the audience, or should I start with mine? I can. Oh, please.
So on one slide you have like sensitive data and exceptions. Okay, so again, I'm not a lawyer in that field. So when we read the exception, so there is a difference between the definitions and how someone interprets it in a sense. And then more or less in different situations we can use some exceptions. So I'm just interested in how these things are solved, in a sense going from some, I don't know, theoretical framework in which you specify the exceptions, and then to some practice in which these are really the exceptions or not.
This is a very interesting question. So I think the underlying theme is that the lawmakers here in the European Union believe that there is this group of sensitive data, that in nature they are extremely vulnerable and sensitive. So if we use them, they will cause significant harms to the data subject and natural persons. So that in principle we should not use it unless there is a legal ground that is on the right hand of the slide. So this legal ground is an exhaustive list provided in the GDPR, which lists some of the most important reasons for which we can use health data and other sensitive data. But I would also point out that this list is not actually exhaustive, in the sense that it also leaves room for member states to change and to introduce further obligations, such as if you look at here, on the left hand of the slide, it says that when it comes to data such as genetic data, biometric data, and data concerning health, member states can maintain their own rules or introduce new limitations in this area. So, which means that, okay, we have this law forbidden, and then we have these exceptions to use, and then under which we still have member states' rules that we can further introduce a limitation. So which makes the legal framework and the legal picture here extremely complex when it comes to health data usage. And that is also the reason why the European Union is now introducing another law. They're saying that, okay, enough, we want a new law that further harmonizes the usage of health data here at the European Union level, so that if we have this law, we will have more simplified, more better processes for we to get data and process data. So I hope that it will be easier in this new framework. But now it's quite prohibition, exception to exception. It's quite complex. Yeah.
Okay, thanks.
Okay, thank you. Just, a quite generic question, but it's important in AL context. So health data are really important and are really critical, but many AL application and research involve also social data like, habits of person and so on, not so specifically related to health. Have you understand or exploit this boundary, or in both systems is still a bit unclear?
Oh, really important questions. I understood it. So this really points out to this very important legal discussion, that is the definition of health data. Because currently the definition here in the European Union is very broad, in the sense that any personal data, so if it has the potential to reveal a person's health status, then it is health data. It doesn't necessarily have to be like a medical records in the electronic health system or in the hospital. Any data, so such as the societal or other personal piece of personal information, if jointly or separately, if they can reveal a person's health status, then it would very likely be regarded as health data under the law. So that is also the reason that there is scholars arguing that now it is pointless to even distinguish health data between other personal data, because in theory, if we combine this big data, so there is a way to figure out people's health status. So yeah, the answer is the legal construction or the legal interpretation of health data now under European Union law is very broad. Yeah.
Anyone else want to ask a question? I was just a little bit curious. I don't know what slide it was. You had the different categories for how you were going to do your comparison. I wanted, if you could go back to that.
Here.
Yeah, I was like, how did you choose those? Because it feels like anonymization, legal basis, like like trend of development. Like how, like what is that? Feels like not that legal to me. It seems a little wishy-washy.
Oh yeah, yeah.
Like is that how you're conducting your comparative study?
Yeah, I can elaborate on that point. So the first one, the legislative path, is more like the first question that we investigate when we study the legal system of a jurisdiction. Like what kind of laws has been introduced here? So for example, in the EU, there's this GDPR, but also some other laws around GDPR, right? And in China, so they have also taken some legislative path. So that is the first question to investigate. And the last point, the trend of development, is my sort of observation or prediction to sort of understand where this jurisdiction is heading to. Like, for example, in the EU, we've seen that previously, before European Union law is not saying too much about health data, and then we have this GDPR, and in the future we will have another law. So from this harmonization approach to a more utilization-based approach. So, in this point, I sort of understand and study the trend. And the 3 points in between concerns the extremely essential and important question when it comes to the legal regulation of health data. The second point is about protection, like what is the protection mechanism, and the third point.
Those three in the middle feel like concrete, like legal, and the two on the outside. And
Oh,
so
yeah.
This makes me feel like they're not like all under the same umbrella, and then it makes the comparison. But we can talk about this, I think.
Yeah, I understood your question. So there is also like, I would say that it's different levels of comparison. Like, there are also like theories that are proposed in comparative legal research that when we compare like a jurisdiction, there are different levels of comparison. We can compare like the very holistic and systematic point, like the legislative path. Like, do we introduce this data protection law to regulate this area? So that is a point to compare in doing comparative law. And also, but also under that, what kind of specific mechanism have we introduced to protect, to utilize, or to anonymize health data that are more like specific and concrete points to compare? And this you could see that is the micro level of legal comparison. So like here, yes, I've sort of like combined this macro level of comparison.
Yeah, that's.
Which includes the legislative path and the direction of travel, and also the three more specific and a micro level of comparison, which digs into more of the specific legal mechanism and institutions that are introduced by each jurisdiction. So it's, yeah, as you have rightly identified, it's a little bit of combination of both, yeah, levels.
Great, thank you. That helps to clarify.
Thanks.
If I could pick up on one point, you mentioned very early on about the intrusiveness around the Internet of Things and the desire to gather more and more data. And obviously I want to link this to the very wide interpretation of what health data can be. And this relates to a point I kind of made earlier as well about there's an issue about where, not just where, but also why data are collected, but also where it is stored and when it is accessed. So it occurs to me that the idea that we need big data approaches which gather as much as possible from people and have wraparound care with multiple sensors is certainly over the top in many, many ways. But there is that question of where the data are stored. And isn't there an argument here for more edge computing rather than transferring those data to some central servers and also therefore for more analytical power to be in the individual devices and only access when certain circumstances arise, and therefore retaining a greater level of privacy unless there's a particular issue, a fall or an emergency that might need to be responded to, or otherwise with the consent quite clearly of the person being monitored.
Thank you for your question. Very, very important. So my understanding is that first, the place of storage, such as at this terminal or like in the edge, so I'm not sure if that would impact the legal interpretation of health data or the legal understanding, because as I said, the current legal interpretation is very broad. So if a personal data jointly or separately can reveal the health status of a person, then it would be likely to be construed as health data in the law. So I'm not sure in this part whether a place of storage would play a role. I think that would need more, probably more discussions and analysis. But in addition to that, I completely agree that the introduction of edge computing and things like that would probably help satisfy other areas of legal compliance when it comes to data protection. For example, there are the legal requirements on the storage. We cannot store data forever. We must delete it if there is not a need to process the data anymore. So in that sense, I think edge computing definitely plays a very important role when it comes to data protection. Yeah.
Okay, thank you, Zhicheng.
Thank you very much.